Hello, everyone, and welcome back to the blog. One of the keys to our pandemic response is having the best possible evidence to make informed decisions. And with the ever-changing nature of this pandemic, we often need that information quickly. And that's where the Scientific Advisory Group, or SAG, comes in. SAG connects with clinicians, operations, researchers, and other experts to review, synthesize, and interpret emerging evidence and guidance from national and international bodies regarding various facets of COVID-19. The focus of these reviews is to proactively support staff and patients during COVID-19 and to support best practices in healthcare settings across Alberta. Topics range from exploring viral transmission in condominiums and apartments to determining the best strategies for controlling COVID-19 outbreaks. So joining me to tell us more about the Scientific Advisory Group are its two co-chairs, Dr. Breda Mans, who's our Associate Chief Medical Officer, and Dr. Lenora Saxinger, Physician and Medical Lead for AHS Antimicrobial Stewardship North. So thanks for joining me, and I'm going to start off with you, Braden. I gave a brief overview earlier, but can you tell us about the role SAG has been playing in our COVID-19 response?
So the Scientific Advisory Group gets requests from sort of 4 different places. Our Dina Hinshaw, our Chief Medical Officer of Health, sends us questions to answer about things around public health measures. Our Emergency Coordination Center sort of vets the requests that come from clinicians, from operations. We get questions from the Personal Protective Equipment Task Force. And of course, you sometimes send us questions as well as your executive leadership team. And actually the best thing about scientists don't like working in their offices, or some do. But I think scientists love it when they get to answer questions that are of relevance. So we're not just digging up interesting information, we're answering questions that are most important to each of these groups at that particular moment in time, which is why it's important to answer these questions quickly. So the questions and the answers to those questions get embedded in our organization's order sets and the pathways and the policies, and ensuring that best evidence is embedded in those. And best evidence, as you know, is changing quickly in COVID.
So when we think about this group, Scientific Advisory Group, why is it so important to have such a wide range of expertise?
The response to COVID has been multidisciplinary across, it's not just physicians, it's operations, it's allied health, it's pharmacy. And so we need representatives from all of those major groups. So on the committee, we have representatives from emergency medicine, critical care and internal medicine, respiratory, all those groups that are seeing these patients on the front lines. But we also have members from public health and infection prevention and control, infectious disease. Alberta Health is represented there. Importantly, the reviews, though, we learned quickly that we also needed to engage our external experts, workplace health and safety, our provincial infection prevention. In terms of the amount of work that's gone into supporting these answers in that group that I just mentioned, we've completed 72 reviews now. In the first 4 months, we were going a lot faster. We completed about 55 reviews, and we did an informal tally of the amount of hours that people devoted to Scientific Advisory Group, and it was about 5,000 hours just that first 4 months. So 17 hours for the people that put the reports together, about the same for the members, and about 900 for Lenora and I.
Lenora, I'm going to come to you next, because I'm sure the next question people are asking is, what are some of the major reviews that you've done, and what kind of impact do you think the group has had on Alberta Health Services and for Albertans?
Well, I think that some of the big pieces of work have actually been really fundamental questions to our knowledge about COVID. And those are the ones that we've returned to again and again, because the controversies around asymptomatic transmission, for example, controversies around the role of children in transmission of COVID in the community to each other, and risks for children in light of, when we were coming up to school opening, are 2 examples of really fundamental questions that required multidisciplinary lens. Many different pieces of and types of literature had to be synthesized. And when I look at work like that, which was really a big endeavor, and really we had tremendous and varied discussion around the Scientific Advisory Group table about these things, I actually am very impressed that a lot of these reviews have really stood the test of time incredibly well, compared to a lot of guidance that came out early, that in fact our approach and our methods were really giving us good, robust answers that had staying power. And whenever we've updated them, it's always been an incremental change. It's never been a big about face in the way that we're going. And so I think that it really does speak to the rigorous process and the people that we have at the table, that things have been working out that well. And I think that the impact that those have been across a lot of domains. And then we also get some, important, more targeted questions where it's really to answer what needs to happen next. And so some of the work for the PPE task force kind of fits under that category as well. And those are also kind of satisfying. And usually it basically takes the place of a lot of people having to try to recreate that work. And they have it all at their fingertips when it comes time to make decisions. And I think that's immensely valuable.
So what kind of feedback has the group received on the work? And also, have we been able to share some of our findings with other groups, like other health authorities or other health agencies?
I've had some really interesting feedback, actually. I think that the scientific advisory group reviews being posted have actually turned out to be really useful repositories of references, of knowledge, of recommendations for multiple jurisdictions across Canada. I've had a lot of physicians reach out to say, hey, I have a question about this review. I know that there are places that look to see when there's a new one posted, because we've tended to somewhat predict and work in concert with other groups on the same questions. And so if we get something out first, I think it actually does provide really useful information across Canada. And I've also had feedback from international groups that appreciate the caliber of the work that we do, and have found it very useful. So I think that actually the reach is well outside AHS, and that the transparency of information sharing is really reflects well on the whole organization and has been very useful.
Great, thanks very much. And right now, anybody who's in the public domain can access these reviews through our public website. And so that's obviously something important for everyone to know. So last question for both of you. What do you think the future has in store for the group during the pandemic and maybe beyond? So Brady, I'm going to start with you first.
As we all report up to you, you will tell us what the future holds for us. But what the short-term future certainly holds for us is we've got some questions that we're looking at right now. We're updating, our evidence reviews around personal protective equipment, what's needed in various situations. We're looking at things like somebody gets a runny nose and a sore throat. They go get a test and it's negative, but they only have a mild runny nose. What's the chance that they would still have COVID, and could we take those people off of quarantine? One of the trend that we've seen is that the questions have become increasingly complex over time. We initially looked at hydroxychloroquine. Did that work? Well, that was a pretty simple question in some ways compared to some of the questions that we're getting now. So we're not doing as many reviews, but we're looking at an increasingly complex questions. And oftentimes it's not like I knew nothing about COVID-19, and I also knew nothing about coronaviruses, which is why we got Nora involved, because she does know the literature in that area. But no one was an expert in COVID at the start. We've all been learning together, and sometimes it's just helpful to have an external group like SAG look at a problem with a different angle and from various perspectives. I would imagine that we'll continue to work with amazing individuals in infection prevention and control and workplace health and safety. I know there's been some initial discussion. Well, when COVID ends, will the scientific advisory group, will that be the last chapter? And perhaps it will, but we've seen some unintended good consequences coming out of COVID, and this idea that operations reaches out with the burning questions that they have, and we're able to get a review together to answer those questions within weeks and ensure that evidence is embedded into the decisions that operations makes. You can imagine that idea could carry forward into other areas of healthcare moving forward.
Lenora, what about for you? What do you think the future has in store for this group?
I'm really looking forward to the end of the COVID questions. Honestly, I think that'll be fantastic. I actually would just echo what Braden just said, which was, I think that the scientific advisory group, because it took direct questions from various groups and then actually reached out, we would get different reviewers involved. We would engage with different groups to try to get data to answer questions. It actually proved to be quite a nimble and very efficient way to kind of streamline how we're trying to do things within AHS. And it it organically became, I think, a place where people would come to try to figure out tough problems. And I think that it worked really well. I think that that continues to be something that should be looked at, whether scientific advisory continues or not. Because that direct line of question, that direct linking of different groups that don't always communicate necessarily, but in the service of an overarching question that is important, really seemed to help focus work in a very productive way. And so I learned a lot along the way so far, and I'm sure will continue to do so. But I think that the structure might hold some lessons for us, and that the questions that we're answering and starting from the place of what is, the best truth we can come to right now to answer this question and to provide the best care is, immensely valuable and important. And so I do hope that we do take that somewhere. I don't know what shape it will be or who all will be involved, but I think it's been really a very valuable experiment in that respect.
Wonderful. So thanks to both you, Braden and Lenora, for coming on today. And really, I want to relay our thanks to everyone on the Scientific Advisory Group for all the incredible work that you've done. And really, I think has made a huge impact on decisions that we're making in terms of the care for COVID-19 and beyond. For me personally, I think this highlights how we are progressing as a learning healthcare organization. And Braden, I see this as part of the SCN evolution. We knew when the strategic clinical networks first started, we saw more and more consults that were coming to some of the SCNs. And I think this for me is sort of the amalgamation of all the things that have been developed for the strategic clinical networks. And I just see this as sort of the next part of where we can advance. So I actually think there is a huge potential for this beyond COVID-19, and look forward to debriefing with the Scientific Advisory Group as to where this takes us. The type of information you provide for us, as I said, has been exceptional. I don't think we would be where we are in our pandemic response, in fact, if not for this group, and is another example for me of how people at AHS always comes together to support each other and to provide quality care and protect the health of Albertans. So thank you to all of you. It's challenging times for all of us. I want to thank everyone who's watching for their continued dedication and contributions. You continue to all inspire me every day. Thank you, stay well, and we'll see you next week.
Together, we do amazing things every day.